My eyelids are puffy and heavy. Would the double eyelid surgery or removal of the fat/muscle treat it? My eyelids are very puffy and heavy. It is especially bad when I smile. I know I would like muscle and fat removed to make my eyelids more flat. I don't like the double eyelid look on me. So should I ask for just fat removal? If I do get a double eyelid surgery, I think I would want a very tiny one, like the one in the photo. Would I also be able to get a parallel crease made instead of tapered? The outer corners of my eyes are very droopy as well. Would a double eyelid surgery fix that?
Thank you for your question. You've explained in great detail your concerns about your upper eyelid looking heavy, especially when you smile, and that you want to have muscle and fat removal, and at the same time you don't want to have a double eyelid, or that if you do, you'd want a very thin one. If you have a thin one, can it be parallel? And also you mentioned some hooding on the outer aspect of your eyelids. Well, certainly your concerns about a double eyelid surgery and the impact on the character of your face are things that someone with experiences has heard. As a cosmetic oculofacial plastic surgeon focusing on Asian eyelid surgery and in practice for 20 years, I could tell you that there's a lot of discussion necessary, and a proper physical exam is also necessary. In other words, the questions you're asking can be answered to a degree with just photos, but nothing replaces the three-dimensional aspect of appreciating skin quality, fat volume, and in terms of asking the question of like the tapered crease versus a parallel crease, as well as the lateral hooding, that takes an actual examination to kind of mimic. And what we do in our practice, we'll actually place a little Q-tip inside to create a fold to give us some idea of what to anticipate. I always tell my patients that in the cosmetic surgery literature, it is often quoted, I should say, that 50% of people of Asian descent have a crease and 50% do not. And what I try to explain is that everyone who comes to me who wants to have a crease, that nature gives us a little bit of space and permission to work in. And when we fight too much, then we get some unpredictability. So for a lot of our patients who come in who want a specific style, they'll often bring pictures of people who they admire and they want to look like. But if their skin quality and anatomy and the position of the eyes is different, then certainly we have to come to some kind of customization that's right for them. I would anticipate, just from experience, that someone like yourself would probably be better served with a nasally tapered crease, as well as it extending more, well, relatively parallel without a flare in the outer aspect to address the hooding. Now, this is something that can still be customized in terms of the degree of fat reduction and the amount of crease that you do show. Again, this is more of a discussion that is best served by a physical examination. So I would advise you meet with experienced cosmetic surgeons and have this discussion. The factors that also to discuss have to do with whether or not you have extra skin. You can choose between an excisional Asian eyelid surgery or a non-incisional. So there are many choices, there are many variables. And so with that understood, an examination will probably help you understand better what your choices are. Meet with a few doctors, get a sense of what is realistic, and then be sure that whatever you are going to do, that you are comfortable with choice and that you have a sense of what you will look like when everything is settled. And again, it's very important that you actually meet with doctors and have an examination. So I wish you the best of luck. I hope that was helpful, and thank you for your question.